Hey guys, it's Kris and you're watching Burst TV. If you haven't already guessed by now, the Burst community, everything you see created by Burst Oral Care, we're all made up of dental professionals. So I have 4 fun questions from our viewers because the people want to know about dental related stuff. So here we go. All right, first question. Where do you go when you say you'll be right back? What do we do when we say we'll be right back? Could we be recording a TikTok?
I say that I have it, you know that I got it, no need to look all in a bag. Stunting like this cause I work so hard, I'm the best, I only speak facts.
Or maybe we're crying our eyes out because we've had a very long day. Or maybe we're trying to prep ourselves up for the next patient because we're ready to get through this day. I don't know. I promise you, we're probably not making a TikTok in between our patients. We are most likely getting the dentist because we're ready for an exam, or we might need to take a sip of water because we're seeing patients back to back, every hour back to back, or maybe every 45 minutes, or maybe every 30 minutes, depending on which type of specialty you're working in. So when we say we'll be back, it's usually not for a very long time. Maybe it might feel like a long time for you guys, but I promise you we are being productive. Whether we are getting the dentist, we're taking a little break, we're catching up on notes, we're putting instruments away, we're cleaning up instruments, sterilizing, we're doing a lot of things to stay productive so that way we can leave on time. Question number 2, do you eat candy? You didn't see anything. Of course, we eat candy. I mean, we're human. I myself, I am a more chocolate person, but I do love like gummies. I love that stuff. But of course, we know that when we are eating stuff like that, that are sugary, that are sticky, we always got to make sure we are brushing our teeth like we tell you guys. So it's not any different telling you guys to brush your teeth after you eat candy. Of course, we like to moderate what we intake, but we eat candy. We love it. We love sweets. Third question, do you actually floss every single day? I'll be completely honest, before even becoming part of the dentistry world, I was never a good flosser, ever. I'm pretty sure I had gingivitis when I was young, but I've been a better flosser since then. And yeah, there are times where I probably skip flossing because of pure laziness. But that's just me being honest, and I can completely relate to patients when either they're very tired or they, things happen in their life, stress comes in their life, and the last thing they want to do is think about their teeth and they just want to go straight to bed and not worry about it. So I can completely relate when it comes to things like that, but it is still very much important to keep your teeth clean, especially in between, because a lot of times all that bacteria, all those cavities appear in between the teeth. So I'm really thankful that there's different alternatives for people that they can use to clean in between their teeth. And I always tell people you gotta keep it in sight, so that way it reminds you. I mean, it reminds myself to remember to water floss or to floss, because I keep it right there on my counter space, so that way I remember it every time. Fourth question, this is a good one. I was thinking of being a dental hygienist. Do you like your job? Of course, you're gonna get different answers from different people, but for me, I will say yes, I do enjoy being a dental hygienist, and some days I might love being a dental hygienist. And I think it's because throughout my 8 years of experience, I found things that have kept me engaged and kept me motivated to continue that passion that I have. So I do love building that relationship with my patients. I love that they can trust me, trust my knowledge, trust my skills when it comes to taking care of their teeth. So I am just truly happy to be in this career. And when you do find a dental office that you feel set in, you're gonna build a relationship with them. You're gonna can make them your second family. I love the community of dentistry. I love that we're all fun and we're interesting and we're just quirky. We're just all like-minded people. And it's 2024. There's just so many different outlets that you can do in dentistry outside of the clinic. So you don't always have to work in clinic. You can do research, you can teach, you can do conference talks, you can even work with a brand. So it is just really fun that dentistry is always evolving. There's new things happening and I'm just here for the ride. So I don't know how long I'll be in clinic, but right now I am enjoying it and I love what I do. So if this is something you want to do, then of course take a look at all the things that you need to get set up, you know, all the courses that you need to take, you know, if you need to shadow different offices to see if this is truly something you want to do. I think it's a great career. And also, most times you don't work weekends. Thank you guys for watching this video. If you have more fun questions to ask us, please drop them down in the comment section below. But until then, stay tuned for more birth teeth videos every week. Bye guys.